Welcome, team, to Plastic Surgery Untold. I'm Dr. Johnny Franco, board-certified plastic surgeon, also known as Austin Plastic Surgeon. You may notice we have a few new faces in the crowd here. We got a little special edition of Plastic Surgery Untold. So today we're actually going to talk about virtual online consultations, and this came up amid of the COVID-19. So let me introduce our regular cohort, and then we'll get into our special guests here, and we'll talk a little bit about why we're doing this cast, and then we'll actually get into what it is. So all of you guys know celebrity anesthesia, Travis Osborne.
What's up, you guys?
And we'll get caught up on his life in just a little bit. And the world's most beautiful man, G. Berto.
What's good, everyone? How y'all doing?
Well, I hope everybody is excited for our two guests. So I'll start next to me. This is Lindsay Mays, who's actually our patient care coordinator. And so some of you who've been in the office, I'm sure know her. And then next to her is Sarah Mack, who is our nurse injector. And along with being a nurse injector, she also helps with all of our patient flow in terms of labs, clearances, and so forth. So the two of them are critical in terms of our practice's success and then really making life easy for you and life easy for me, which is probably most important.
That's what I'm here.
Most
Important. That's my number one goal.
Yeah. And we have them here because I think most people don't realize your guys' and the patient experience is really 90% dependent on them, you know, and so Lindsay's probably the person people have most contact with in our office in terms of scheduling surgery and doing those type of things, and so brought her on so she can help with the process because I think virtual online consultations are absolutely fabulous and going to be a big picture over the next month for sure.
Oh, yeah. We got some changes coming just socially. Overall, in general, things are changing.
Before we dive into everything, maybe we talk a little bit about changes that we've made. I'll tell you some changes we've made in our office because of the COVID-19, and then maybe get you and G. Berto's information on what things you guys have done at your specific centers. I know in our office, we've talked a little bit about, I think people don't realize in medical offices how many things we do just on a daily basis that were routine that people didn't even know about. I mean, wiping down every counter, every room between patients, the special washing techniques of stuff, how many single-use gloves, other things that are changed, obviously, between every patient. Things that we've implemented in our office to try and make things better for people is... One, anyone who wants to do a virtual online appointment is welcome to do so, and that's everything from consultations to follow-ups. And then the point of this is that we're limiting the overall flow in the office to help with some of this. Obviously, there's certain people that need to be seen, but those that don't, we can offer this. Even if you're someone who lives across the street, this may be something that's easier for you. I think with the school changes and stuff, that's going to be something logistically that's going to make a big difference for people. I'd be interested to hear from Travis at the surgery center or Gilbert at a dermatology office, which typically has a much higher flow in terms of number of patients, and you're at a large practice which has multiple providers and a large amount of people coming in. What changes either of you have made in your offices?
You want to start?
Yeah. So
beauty before age?
Actually, I think I'm older too.
Yeah! He's just a fine wine. He is just a fine wine.
Actually, no. I'm gonna start.
I'm distinguished.
I'm kidding. No, what kind of changes have you guys made?
We're following pretty much all the CDC guidelines. We have hand sanitizer, at check-in, at checkout, in the patient's waiting room, in the rooms. What else are we doing? We're also offering patients the ability to kind of have more flexibility with their schedules and with their appointments. I know this past Friday, the powers that be were kind of testing out different telemedicine platforms, trying to, prepare in case, provider has to be quarantined, in case, staff needs to be quarantined, just kind of getting ready for everything.
And to that point, I mean, and I know all of you do a lot of TMA, Texas Medical Association reading on your free time. They actually just issued a statement on Friday that they have expanded, because some of it in the past was state regulation in terms of what was allowed via telemedicine or not, and they have now expanded that where all procedures, treatments, and actually prescribing of any medication can now be approved via telemedicine.
Yeah.
Doesn't even have to be video conferencing. It can be just via phone calls. I don't know how long this will last, but during this right now state of emergency, and I think that's really going to make it easier because it had been a regulation stuff that made some stuff hard for us. That was a big move by the state that's going to allow a lot of, I think, improved access to care for our patients from our standpoint.
I think there are a lot of people around town that are disgruntled by some of the changes that, oh my gosh, South by Southwest is canceled. Austin just issued something the other day that said, can't gather more than 250 people together. And the whole goal of that is just to decrease the amount of people and the possibility of exposure to other people. So all these steps that people are taking, it's for the public safety, and it's from a good place. They're not being mean. They're not telling you, stay at home, don't go anywhere because they're being mean. This is something to decrease the transmission.
Can you maybe explain to people, because I think people are a little confused, and I had this conversation with my mom on the drive here, of why we have to, and from you and Sarah who have worked in the hospital, I think people are having a hard time understanding why this decrease and why we need to expand the curve and what the actual purpose of this slowing the spread. Because the idea is not that we're going to stop the spread, but we're controlling the rate and why.
Exactly. I mean, we can probably both talk about this, but there's an incubation period, and there's also a time where during that time you're actually contagious as well. So the less contact that you have with people that have been possibly exposed to the virus, who are either carriers or actively have the virus, the less the transmission rate. I mean, it's as simple as that. So if you decrease the amount of people that are around each other, if you don't have these events where there's 20,000 people around each other, you're decreasing the risk of all of those people being exposed to even a handful of people that may be there who were carrying the virus.
And the problem becomes this. And so, most of the people in this room for this podcast could get this and would be just fine. The issue becomes what the healthcare system can accommodate. And that's going to be the problem, is the number of ventilators, the number of ICU beds, because of those people that exceed that. The idea is that we're spreading this over an amount of time that our healthcare system can handle it. And I think people have to understand this is part of being a good neighbor and understanding, like, look, it's the vast majority of people that get COVID-19 are going to be absolutely fine. But if you think about it, 1%, 2%, 3% of our entire population starts to become a very, very large number that our healthcare system cannot manage. And so the idea is we're trying to make sure that our healthcare system still has the capability to treat those that do have problems.
Especially when you're exposing that pathogen to the elderly folks and young children that are at highest risk for having morbidity and mortality from this disease process. So, like you were saying, the ventilator number in the U.S. that's a stagnant number at this point. I mean, we can't just overnight pump in 50,000 new ventilators into the U.S. So if we exceed that number, I mean, we don't really have any other options. So it's just about limiting the exposure, limiting the amount of people that are exposed to the pathogen.
Lindsay, maybe tell us a little bit in the office, calls that you've gotten, things that you've heard. I know that we've had a little bit of both extremes, people wanting to move their surgeries up, trying to get in ahead of this. We've also had people wanting to reschedule. Maybe give us just a little feedback of what you've heard from our patients and thoughts.
Yeah, and I think right now their concern is mostly either wanting to get their surgery or procedure done now before they put a pause on anything, or B, pushing it back because they are not sure when it's going to, basically what's going to happen over the next month.
And I think that's important.
It's the two mediums.
This isn't a sprint. And I know I got us out of kind of normal order, but I thought it was important to touch base on some of these topics. I thought it was important to know why we're doing this special edition of Plastic Surgery Untold. But if you'll let me regress a little bit, I want to give our two guests a chance to introduce themselves and why they're a part of this podcast today. And hopefully, depending on how they do, we'll be a part of a future endeavor. So maybe we'll just go from right to left. Lindsay, give us a little background on you and how you ended up as part of our practice and so forth like that.
So I have been in aesthetics for about 10 years, 10 plus years. And I wanted to change. So I love the aspect of being able to.
What did you do in aesthetics before being a patient care coordinator?
I was doing facials, basically.
An esthetician?
Yeah, thank
Okay,
you.
cool.
That all of my coffee is not yet processed in. So facials, you name it, I did it, and I just wanted to take that next step on where my career was going. So this was.
And what do you do for people who don't know what a patient care coordinator is? Like, what does that mean to the average person?
Awkward silence. I basically.
Just tell us
Hopefully,
what your day is.
my day is answering patient calls, just providing kind of everything that they need to. So answering about surgical procedures, how their pre-op process is going to go, how their recovery is going to go, if they have questions about X procedure. So, breast aug.
Because the patient care coordinator in the practice typically leads people through the practice. So this is going to be your concierge that's going to lead you through the system. And so when people are calling to get information and then being led through it, and so that's why I think it's important for people to meet our Lindsay, our PCC, because this is the person who's going to help guide you through the journey. And so they're going to give you information coming in so that when you meet with me, you have a worthwhile visit that's very informative, and you already know what questions to ask. And then afterwards, no question like anything else. After the visit, then you really, 1,000 questions pop up, so you have a point of contact afterwards. And then she's the one that's going to work with you and the surgery centers to make sure everything flows. Because when people schedule, that's just the beginning. Then get into pre-op, and then going into everything else afterwards, the post-ops, the other things that need to be done. And then this leads to Sarah. Can you introduce yourself, and we'll talk about a little bit about what you do?
Yeah, hi. So I'm Sarah. I've been a nurse for 12 years. I'm newly into aesthetics. It's something I've always wanted to do. I've actually spent the last 12 years in the emergency department, so I can speak to, the panic and frenzy that comes with things that we're dealing with at this time and kind of the ins and outs of all of that. But currently now I'm happy to be at Dr. Franco's office. Right now I have two roles, I would say, in the practice. My first initial role was kind of going in and doing assessments with Dr. Franco. I've learned, the ins and outs of the sizing of, anything from a breast aug all the way up to post-op, questions and things like that. I also play a role in obtaining labs, EKGs, mammograms through your primary care physician before your surgery, reviewing the results and kind of chatting with Dr. Franco about if we need any interventions or anything like that. So,
and I think people forget how many people are involved in your care and how many things need to be done before we actually get to see one celebrity anesthesia, Travis Osborne. But us doing a good job between Lindsay and Sarah decreases the awkward conversation. You want to talk about awkward silent conversation when Travis Osborne has to come to me and say, hey, we got to cancel your surgery.
Yep.
That's an awkward conversation between me and him, and then an awkward conversation with the patient, and especially if we're doing people from out of town, even people in town. If you've taken off 2 weeks of work, you've gotten grandma coming in, you got the in-laws coming in, you've already weathering that storm, and now you get your surgery canceled, you can't just ship the in-laws out.
Sometimes you wish you can.
But
just kidding if y'all are listening.
I think it's important for people to know how many people are involved in their care.
Correct.
And why, they are so important to the day when you and I come to do stuff.
Yep.
That's what makes stuff smooth. And you could tell me, but you probably see a difference from office to office, those that are organized and those that are not.
Big time. I mean, you guys do a great job. We've spoken, at length.
He's on payroll, so we got to say that.
We've spoken at length, over the past couple of years. We've been working together about what can we change preoperatively, what can we do pre-screening wise, which has trickled down to helping make that system much more efficient. And now you guys are, y'all are stellar as far as catching stuff early. If a patient has, diabetes, having lab work sent off, if they have a heart history, if they're on, antihypertensives or different medications, you guys are great. Sarah will send people or recommend people go out and get an EKG, and Dr. Franco sends them out to their primary care, gets that stuff knocked out, so that I'm not dealing with that for the first time when I see the patient day of surgery, because that is a very awkward conversation.
It's heartbreak for everybody.
It is because for me, I don't want to lose that case either, because I'm doing that case. I have already set my day up to accommodate that 5 or 6 hour procedure. We're ready to go. We've got everything ready there. We've got staff there at the surgery center. So it hurts everyone. And that's not something that we take lightly at all. So that has, almost dropped our cancellation level to
And I think
0.
one of the things too with our patients is me speaking to them ahead of time helps to the consultation with you goes so much smoother, and they can actually focus on their consult and what their goals are versus kind of like that background question. So like financing, pricing, what happens before, how do I travel? So that's my goal, is to have all of those questions answered. So then you are just focusing on
the actual procedure.
Yeah.
100%.
Yeah.
And I think this is where that pre-phone call when they talk to you really gets through a lot of the stuff, because it's hard in a short amount of time. Everybody gets nervous. And so I think the more they can answer, then just the few remaining things are great. I also think it's important for them to understand why they get 5,000 phone calls from the two of you, because the more we can do, and this is why we're so strict about trying to get labs, everything done 3 weeks before. And then, this is a perfect segue to roll into virtual consults, because I think that virtual online appointments are absolutely incredible. I think this is the wave of the future. I think that, for all the difficulty and uncertainty of this current situation, I think with intense adversity comes great innovation.
Totally.
And I think that this is going to force us to become better. I think this is going to force us to be more accommodating. We've talked, and it's been, if anyone who's been watching politics for the last year, 4 or 5 years, 8 years,
Easy.
Healthcare is a big issue. And how do we have access? I think the idea of telemedicine, virtual consults, these things is going to increase this greatly. There's, again, to the limit of what our healthcare system can do. We're pushing that. And so I think there's ways to expand that. You look at a state like Texas, and Lindsay can attribute to this, 70% of our patients come from outside of Austin. Yep. Many people want to come in, they want to come to a specialist, but how many people do you get calling saying, I don't want to drive 5 hours for a 30-minute appointment and then 5 hours back, because it may be a 30-minute appointment for us, but that's a 12-hour day for them.
Absolutely.
There are a lot of calls, and one, they want to meet you in person and have that one-on-one connection, but two, some of them feasibly with children, day-to-day activities, lives, they just can't. And so that's what I'm here for, is to set up that virtual, with yourself, and to kind of go over the same questions, and we go over the same thing, virtual or in office. So that way they're as prepared as they can be.
What I think is so cool is that you guys already have a virtual consult platform built into your system. So this COVID-19 and the coronavirus, this wasn't you guys going, oh my gosh, hitting the panic button, what do we do now? You're just saying, hey, let's do this for more patients now and make it, completely available to everyone. That way we've got a nice segue into this instead of, reinventing the wheel. You guys have been doing this for a while.
You'd be surprised how many people have reached out to me over the last 3 days on how we do our system. Yeah. And we've really tried to share that with everybody, because I think that, one, is the wave of the future. Two, I think it's the wave of right now to make stuff safe. But let's do this, if you guys don't mind, just because I feel like we've got a good background. But let's maybe go to the very beginning and then kind of go through how and exactly what a virtual online appointment is, because I think we've been talking about it, and I don't think everybody knows and how they get started. So maybe if Lindsay and Sarah will help me work through this, and we'll start at the very beginning and work through. And I would love you guys to jump in with questions.
I'm actually going to take some notes, because this is all new to me, so I'll just be kind of over here.
Well, because I'm going to.
Do you want me to schedule virtual for you?
So maybe for his CAP implants, which we talked about in episode 3, if you guys want to go back, we could do a virtual. You got to send some good pictures.
Sure.
Why don't we do this? Let's do this right now. I think this would make it easy. Let's do a little role play for people. I think this would make stuff easy. So Gilbert is calling. Maybe let Lindsay take it, and let's say Gilberto is from the Valley. And
we could say that.
And it's a little far for him to come. Mom can't drive him. He doesn't got his own car yet. and he really wants these calf implants. How can we make this happen? Can we do this?
Absolutely.
Can we do a little role play?
Absolutely.
All right. Ring,
Totally.
ring, ring.
Ring, ring, ring. Hello.
Austin plastic surgeon, Dr. Johnny Franco's office. This is Lindsay.
Hi, Lindsay. My name is Gilbert. It's nice to talk to you. I actually had some questions about possibly coming in to visit Dr. Franco. I'm interested in maybe getting some calf implants.
Oh, wonderful. How long have you been considering some calf implants for?
About a week.
Okay. That's unique.
You just saw Entourage.
Dr. Franco gave him a complex.
Any major life changes you're going through? Midlife crisis, maybe?
Are you saying that I'm old? You can't even see me through the phone.
You said
That's exactly why we have a virtual consultation.
I'm a beautiful man.
Exactly. So where are you calling from?
I'm calling from the Rio Grande Valley.
what is it, 5-6 hours away? Is that
About 5-6 hour drive.
okay?
Yeah.
So you planning on driving up for the afternoon, or would you like us to schedule you a virtual consultation?
What's a virtual consultation?
So virtual consultation, Dr. Franco does either on WhatsApp, but basically what he's going to do is you're going to send in some pictures, and he's going to have that one-on-one with you, FaceTime. That way you don't have to drive 6 hours away.
Oh, that sounds interesting. I might be interested in doing something like that.
Absolutely. Let me get some information from you. We are going to need some pictures of your calves, right, for the calf implants.
Okay. You want my calves or the calves that I want?
Both.
Okay.
So yours and your wish photos of those calves.
Okay.
Whose are they? Who are you taking?
Arnold Schwarzenegger.
Okay, perfect. I don't know. Yeah, we're gonna have to special order some really big ones. But absolutely, I'll get some information from you, and we can get you scheduled for virtual. And Dr. Franco will give you a call, and I'll go over some more questions for you.
Fantastic. Let's get this started.
Let's do it.
So I think a couple of the cool things here is one, it just starts with an initial call, and then the point that they both made is pictures. So people can just directly email us pictures. We also have started a new electronic medical record called Simplast that actually allows people to upload an app on their own, so they can upload their pictures directly on their app, which makes stuff a lot easier. But even if you don't want to do that, you can directly email. I do encourage people, the better the pictures, the better the consultation. And then Lindsay mentioned FaceTime, WhatsApp, Skype. The beauty and where technology has changed, and I was interviewed recently about Virtual Online, asking what type of special technology do you need? This. If you got a phone. If you got a phone, you can do it.
Yeah.
I
No
mean,
flip
unless you got the flip razor that Gilberto's dad has,
My mom still
which
has
is a
it.
true story.
My mom still has it.
He will not get a like a regular smartphone.
But if you have any type of smartphone, you can do this. And so that is the absolute beauty of technology today, is that all you need is a phone and you can do this. So emailing pictures. So then the next step is, once Gilberto sends some quality pictures of his calves.
When you say quality, that means like I can be in my bedroom with the lights dim just right and taking pictures from weird angles.
Yeah,
right?
I mean, I wouldn't scroll back through your phone looking for pictures you sent at 2 a.m. to an ex. Probably not the best pictures. But the better the pictures, the better idea that your physician's going to have.
Absolutely.
So, good lighting, if you can have someone else take them, put the phone on a timer, because a little bit of distance and perspective makes stuff a lot easier. If you're wanting to send pictures of your calves, probably not wearing pants or joggers is probably not the best idea, so we can actually see your calves.
Yeah.
That tends to be helpful.
Can you get your mom to take them for you?
Not with your dad's razor.
not with my dad's flip phone, but maybe when in between her driving me back and forth to school.
There you go.
What? But so let's finish through the process. So we'll send the pictures. And then once we get all of that, we schedule a time, just like we would any other office visit, where it's dedicated for you and I to talk. And so Lindsay will help with all of that to get that scheduled, so that you have time blocked out, I have time blocked out. Please bear with us. We try to be on time, just like any other appointment. Sometimes it's plus or minus a few minutes. We do our best. Then with that time, I also encourage people in your car, with your family, with the radio jamming is probably not. We don't encourage any virtual telemedicine while you're driving, is less than ideal. But the more that you can be in a good spot to have a good conversation, just like you would any appointment, is going to be super helpful. And then we can discuss about all the pros and cons, all the things that we can do with the surgery. Once we get done with that, then it gets pointed back to Lindsay, and then she will send a quote, estimate, anything like that, so that people have a good idea of the procedure. Once they decide, hey, that sounds great, here in a month I want to do my calf implants, then we get the ball rolling, and Lindsay will actually get all those appointments set up. Another pre-op, which sometimes we can do virtually, or in office, and then we always see people either the day before, if we haven't, do the surgery, the follow-up, and then a week and a half follow-up, to that extent. And there's difference. It varies depending on the procedure. We get all those set so people can be followed up. Once we get those dates set, and then we have people like Nurse Sarah jump in and help in terms of labs, other things, because to Travis's point, the better we can be organized about all of those things. And nowadays, you can get all your labs done at home in the Valley and then faxed over to us. And so all this stuff, the world has gotten really small. But that's why I think sometimes seeing how many calls you get from, Lindsay and Sarah and all the people involved in making sure that's streamlined.
Absolutely.
I promise
Go ahead.
Sorry. Your patient safety is our number one concern, your number one concern. So if I am calling you or Sarah calling you about your labs or EKG or whatever else, I promise we're not being annoying to you, or maybe we are, but we care so much about you guys that it is truly our number one concern, because it's an elective procedure and we don't want you on the table with anything, underlying.
And from a healthcare perspective, being in medicine for 12 years, a lot of people come in for an elective surgery. They get their routine lab work, and overall they believe they're generally healthy. Some people haven't been to the doctor in 2 or 3 years, and then that's when we come up with, hey,
If I've never been seen, I don't have any medical problems.
Exactly,
That's
right?
my
How
favorite.
many times have you heard that? And then we find out your blood sugar is 300. We now have to get you to an endocrinologist, and it's 3 weeks before your surgery. That's where it kind of puts us in a little bit of a bind.
Totally.
The odds of seeing an endocrinologist or cardiologist within 12 hours of you finding out your lab work is off is pretty not possible. I just like to express the fact of the importance of people getting labs done almost first. As soon as you know you're going to book that surgery, get that lab work done. That way we have time to either push back your surgery or kind of deal with any results that we may find that you may not know about.
One question I have real quick is how does like patient privacy play in the virtual consult role?
Well, I think this is a couple things, and one of the things like Simplast, this new plastic surgery app, has really made a big difference, because it is based on a HIPAA secure platform where patients can upload. It's password protected, so not only is the phone password protected, so is the app and getting into things. Our email is actually run through a HIPAA secure platform, so that's why it's secure. That's why we try to limit patients just texting us or doing things randomly to different people's phones, so that we do try to really keep people's privacy. We also try to have people limit pictures to the specific body area. And even, I think some people don't realize, even like on our website, just in talking to HIPAA stuff, is we have like case numbers on there, and sometimes people want to know who is a specific person on this case number stuff. Those case numbers are actually made up because they're not tied to any medical record number. It's something for the website that they do, but is not tied to anything in our office, and purposely done so that if that got hacked or we got hacked, there's no tie between those numbers.
Oh, that's interesting.
And so I don't think, again, people realize how many steps we take internally, to protect some of this stuff. And to their point, I think that Lindsay and Sarah will tend to blow up your phone over and over about these labs and different things. But, to both of your points, if, at 3 weeks, you still have time to, change your work schedule, reschedule that date, reschedule grandma to come and help and so forth. If you wait till the day before, especially if you've flown in from out of town on something else, this is a huge,
hindrance.
Whoopsie for your entire life stuff. So a lot of small stuff we can still get taken care of if we got a little bit of time. If there really is a big issue, we can reschedule this, and we have time, and you can still change your work schedule, change other things. So I know we're a pain sometimes, but we're honestly doing it with your best interest in mind.
Absolutely. I think it also puts us in a weird position if they come into town 24 hours before the procedure and like, oh, I haven't had all my labs yet, or I need to knock one more thing out. That's stopped big time. We've made huge changes over the past 2 years to really get that streamlined. But when that happens, it puts us in an awkward position, because if we do find something, we can't proceed. Like we need to get everything taken care of. Like Sarah was saying, it's the patient safety first. I mean, these are elective procedures.
Right.
We're not doing any life-saving blood transplants, or
Right.
you know what I mean?
And we've depends who you ask.
These cabs would be life-saving.
And we've talked about consultations, but I think both of you can attest to, it's not just consultations, follow-up appointments, because a lot of those you
absolutely.
schedule as well.
Absolutely. So we actually just had a recently, out of town patient, San Antonio, not too far away, asked, and I reached out to her, just having had surgery a couple weeks ago, would you like to schedule that a virtual instead of driving into the office? That way, you're not coming in and having that added contact with other people.
And this is something we did even before COVID-19.
Absolutely.
I think now it's become even more important. I think it's going to continue to be, because for patients from out of town, sometimes it's hard to have somebody drive them. Sometimes just, especially other follow-ups as things are going really good, and then if we see something on the online that we need to have you come in, we can always do that. But a lot of times, most of the follow-up, and people who've had surgery can attest this, a lot of the follow-ups is just, can I do this? Can can I do X? And so there's a lot that we can do in a more efficient manner.
Yeah, I agree. And with the app, I think I've had a lot of contact with our patients as far as just kind of sending me stuff over you. So I like everyone to know that I'm available now just because you have so much going on. It's really great to be able to see post-op photos, see little incisions that people have concerns about. They'll message me on the app. I'll run it by Franco as long as everything looks good. That way I'm constantly contacting them, messaging them. Some people send me stuff at 10 o'clock at night and I get right back to them. So I think everybody's really liked that aspect of it.
Same thing with myself. They'll send me a picture and I'm like, oh, I'm not a nurse. I didn't go to school for that. Let's send it over to Sarah. And you review it and send it to Dr. Franco. And
this has been one of the great things, because going to your guys' point about, being secure and patient privacy is, and it's put physicians in a weird world, because we want to be available on access, and anyone who's had surgery with us knows that they have my cell phone, they have access to me. But the great thing about doing everything through our new app is that, one, if Lindsay has a conversation with somebody and then Sarah needs to follow up, or vice versa, everybody kind of knows what's been going on, because there's nothing more frustrating than telling the same story 16 times. And it also, for us, it helps because we're not trying to store pictures, even though it's a HIPAA secure email type stuff, in that type of thing. So now they're in their app, and a lot of this thing is just following trends, as you both know, over time, in terms of our people progressing. Our one snapshot sometimes really, really hard for us. And now, especially, and Lindsay can speak to this better than I can, but, a lot of our online virtual appointment stuff, most of those people schedule months and months in advance, and it's nice to have everything in one spot, so then when we do their virtual pre-op, 6 months later, their pictures are still there in this secure spot, which is pretty incredible in terms of technology.
That is really cool.
Can you guys talk to me a little bit, because I think people forget, well, some of this has got a lot of press. From an anesthesia standpoint, you guys do a lot of pre-screening calls as well, and that's not new for you all.
Yeah, so at the surgery center, every patient is called, and we do a thorough history with them over the phone. One of our nurses does it, and that is basically a catch-all, or we try to catch all with that, and we've got specific criteria that nurse knows to look out for. And then if it needs to be escalated or punted to the anesthesia team, then we, before the case, will actually give that patient a call ourselves. I call patients on my cell phone. Hey, want to have a chat? You marked down that you had X, Y, and Z. What does that mean? What kind of meds are you actually on? What are you doing at home? Just so that we can be prepared day of, so we don't have any last-minute cancellations. Again, this is all being done behind the scenes to prevent last-minute cancellations, to promote patient safety. There's a whole team working together to get things done as efficiently as possible day of.
I would love to hear from beautiful man Gilberto and Sarah. Sorry, you're just Sarah. What role you guys think this has? Because obviously, from Lindsay's standpoint, from a surgery standpoint, this is not new and this is incredible, and I hope to just grow this. But I think that there's a place for this, for the non-invasive, for the injectable stuff as well. And I'd like to hear you guys, because a lot of people just want to know, kind of, am I a candidate for lips, for fillers? Am I, do I need to do surgery? And I feel like that's a great opportunity space for the two of you guys, and see what you two think.
Yeah. I think with injectables, a lot of times people can make this every 3 months, 6 months, or even once a year visit to our office. So I think allowing the virtuals, like we do a virtual consultation of the face. Sometimes I think a lot of clients come to us and want lip filler for the lines around their mouth. And then we're able to kind of explain to them during the virtual, although, you would look great with, a little bit more plump lip, that may not address the issue at hand. And I think that just gives them a really good summary of what to expect when they do actually come for their visit. And then if they are traveling from out of town or further away, they kind of have a really good idea of the products they'll get, the cost of everything ahead of time, and I think they're prepared to come into the office.
Because we had that on Friday. We had someone who wanted to do something, and basically what they needed, or what I suggested they needed, was different than what they had planned. And so at least this way, it wasn't a big shock when they come, and they can still make a decision whether that's a good spot for them. Beautiful Gilberto?
I think for me, in my practice, it's going to be more of like a developing trend, because we haven't been in that arena before, using telemedicine, virtual consults, things like that. The other place I think it would be...
But even for follow-ups, though.
That's what I was going to say. I think for follow-ups, it would be great, because you can sometimes save that patient a visit from having to come in. I usually tell all my patients I'd really like to see you back in a couple of weeks just to make sure everything's settled in well. If we need to do any touch-ups, we can do it then. But that's going to save them another visit, time away from their
Another
work,
2
their
hours
family.
from work round trip.
Yeah,
Absolutely.
So I think that, in my opinion, I think that it has a very powerful impact in that regard.
Because even with a Botox filler stuff, a lot of times if it's new to people, they just have a lot of questions. And I know
Sure.
the two of you guys get post-op question stuff all the time, and they just want to know, is this normal? And again, even if you just live in Waco, try to drive into Austin at 8 in the morning from Waco. That's a 2.5 hour trip.
Oh, yeah.
Easily. And for you to walk in for 2 minutes and be like, oh yeah, that's normal.
Looks good.
Yeah.
See you later.
100%. I think that's why I've been loving the app. I mean, some of our clients I talk to a couple times a day for the first few weeks after their surgery, but just reassuring them, hey, what you're seeing is normal. This is something we've seen hundreds of times. It looks good. Don't worry about it. Feel free to message me at 10 o'clock tonight if you want.
And so as listeners of this show know, my wife had surgery on her knee about 6 weeks ago, and that was one of the biggest things. My wife's an occupational therapist. She sees all these patients post-op, and she really helps with like ortho injuries. So when she's going through it herself, she's looking down and like, is this normal for my knee to be like this? And just having that ability to message back and forth with her surgeon and say, hey, is this a normal finding? Is this okay? Like, can I progress to, doing X, Y, and Z? Those little answers are so comforting to the
So
patient. And now being on, this side, the caretaker, and on my wife being on the patient side, you realize like, from that standpoint, it is so nice to hear that from a provider or from a nurse in the office, say like, hey, it's totally expected. You're all good. That little bit of reassurance sometimes is a huge mental breakthrough for patients.
Yeah, and we always do offer the clients that if you absolutely are just completely unsettled with the issue and you want to come in, we're happy to take a look at you and get you in for an
We always
appointment.
get them in.
But I can't tell you how many clients are just, okay, love it, great, I'll write you tomorrow if I need to, or...
But also, I think people understanding that how much work that Lindsay and Sarah do to get people prepared, because there is a lot of pressure on us, and that's why sometimes I feel like we're being a little hard with patients, but it's for their own good, and you can attest to this. I mean, it's heartbreak if they come in and we have to reschedule them, and so.
Oh, absolutely. Especially if a clearance, and sometimes it's as simple as, getting an abnormal EKG, having to go for, a
Referral to cardiology.
Thank you. See, this is exactly why this is not my
Teamwork makes the dream work.
But yeah, it is, especially when you have a patient who's been wanting this procedure done, for 2 years, a year, and just kind of.
100%, and you'd be surprised how many times Lindsay will be like, "Oh, this patient flies in at 10. They're seeing us at 2." There's a lot of logistics that goes into this, and so part of me just reiterating that over and over is, please bear with us when we call and follow up with you 1,000 times. It's really because we're trying to make this smooth for you. I promise. They're working hard just because they want this to be a good experience. And unfortunately, sometimes if you have a hard time reaching them, it's because they're reaching out to other people. I promise we're not just hanging out playing little TikTok or something else.
Oh my gosh.
What other before we get back into a little other sides of stuff, any other take-home messages on virtual online appointments, consultation stuff? I mean, the one I would say is virtual online, and I'm trying to stop saying consultations, say appointments, because we can really do this to all of your points for follow-ups, for injectables, for other things. And we don't have Katie J here, but even people who have skincare issue stuff, this is a great option for them. So any take-home messages?
Just the clear, the calf pictures, the clearer the better for your appointment, regardless. So if you're doing a follow-up or coming into our office or virtually for the first time, just making sure those pictures are super clear. That way
and we give them guidance. So if it's a breast, if it's a butt, we'll tell you which way. So if it's a breast, here's the specific angles we want. If it's a butt, we even go down to like what kind of panties and other things to wear.
Exactly, absolutely.
I just want to say the word panties.
I know you.
Oh my gosh! How long have you been waiting to say that for?
I'll make sure to make my mom use a ring light when she takes it.
What panties should Gilbert wear on his calf pictures?
We have some in the office. They're the nice little paper,
there you go.
Paper-
The
string
paper ones.
Are they frilly?
thong.
Can
No.
we? Can
They're
we?
they're not reusable. They're
Oh
disposable.
God, no.
You want him?
They're-
You want
no.
you want beautiful G Berto to reuse paper panties?
No,
Oh my gosh.
They're recyclable.
they're disposable, so you can have multiple bears.
so quality pictures. What
Quality
else?
pictures. Just being as open and honest as you can and upfront about any medical history. And even though I'm not a nurse or clearly a surgeon, I can at least give you a little bit of background of what we might need, what we're looking for, kind of what hoops you might have to honestly jump through before having your procedure. So just being, again, upfront and honest with that really just really helps.
Because I think people don't realize when Lindsay does the first call stuff, if there's something that's a red flag, she'll come to me. So even before that we get a chance to talk virtually, I can say, hey, yeah, that's someone who I would want to see the hematologist, the cardiologist. You know, that's something that her and Sarah would talk to, and they can get that ball rolling, because it's even better if you talk to me and say, hey, I already have an appointment on Tuesday for, to see the hematologist. We're getting this ball rolling. There's things like that that just keep the process going.
Yeah.
Well, especially when they're traveling from out of state and they're flying. Again, it's their safety, and if there's an issue, we want someone that's close to home for them. So then that way they have that point of contact, and so at least
Don't hide stuff, because the anesthesia guys are
they'll
sneaky.
find it.
They will get it
I will
out.
find
And
out.
I feel like it's the anesthesia gas confession session.
Oh, for sure.
because they get into the room, they're looking up at these lights, and we've at least 2 or 3 times had people be like, wait, I have a confession.
So what kind of confessions, or what would just put that halter, that stop, that we don't even know until the day of?
Honestly, we
They
do such-
smoked a cigarette when they
Yeah.
were 13 or
We-
something.
we,
like
we do such a good job pre-screening patients at the surgery center, and then you guys do such a good job that we're not really running into that problem of day of hard stops. Basically, one of the only day of hard stops for us is if you eat on your way to the surgery center, if you don't follow the NPO or no eating guidelines prior to the procedure. That's the only one where I'm like, we can't do this case, because that's not safe for the patient.
Right.
Other than that, I mean, if they have something that's huge in their medical history and we have just dropped the ball on everything pre-screening, maybe, but that has happened.
extraordinarily rare.
Oh,
Yeah, and I think something to talk about too is that patients are kind of sort of fearful that you're going to tell them they cannot do the surgery at all if they admit something to you, when in fact it's usually just us sending them for a clearance through a specialist,
Exactly.
a little 5-minute conversation with you, and then I think that's...
But we help them every step of the way. So as long as they're, I mean, just upfront about everything and just being open, and we're with you every step of the way. So we will guide you, and through the beginning, from booking the consultation to the end. It's we'll tell you when you need to start massaging, and if we didn't give it to you, then you probably don't need it.
And if we truly don't do your surgery, it's probably a good thing.
Yeah.
That's because producer Donald's been tapping his watch for the last 10 minutes. So this is just a super incredible topic right now for the times. It's also something I'm obviously very passionate about, because I truly think this is a way to expand healthcare to all. And while I get that we're a boutique in terms of plastic surgery, I think there's some stuff that we can help be, international leaders in terms of telemedicine, online consultations for the entire medical field, and that's why I'm open to share our processes with anybody. But can we do a little fact or fiction for you all? And so maybe we'll do a little something. And so fact or fiction: I never get upset in the office. This goes for both of you. Whoever wants to answer.
Fiction.
Rightfully so when you do. Is that
Be honest, ladies. Be
like,
honest.
Y'all just talked about honesty.
If you are ever, I'm like,
I'll answer this. I feel like rightfully so. I mean, working in medicine for 12 years, I feel like when Dr. Franco is upset, rarely, about something, it's because it has to do with, a concern for, making sure that the patient is safe. We're making sure that things are followed up on. It's a concern like that. It's not just
Fact or
illegitimate
fiction,
concern.
this is the greatest job either of you have had in the world.
fact.
I'm not just saying that either.
Let's do.
No, I'm happy to be here.
Because
No.
there's 2 of you. I want to skip ahead to another one. Probably my favorite section of this is something called Behind the Bovie. And we've touched a little bit, but I'd like for each of you to give the listeners a little something that they wouldn't know. One from a nurse injector, nurse standpoint, one from a PCC, something that they don't know that you guys do behind the scenes that would be a cool little nugget for them.
Ooh.
From the nurse injector and just kind of your assistant in the office as far as dealing with clients pre and post-op, I just think the depth of how much we look into everything. I mean, it's a constant check, double check, triple check. Dr. Franco reviews your labs. I review your labs just in case one of us may not see something for whatever reason that the original lab work, you have highs and lows of all your labs. If it didn't flag on there's a concern. I think we're just really, really thorough and constantly doing so many things, and people realize. I think they show up to the office, they say, hey, I had a great conversation with Lindsay. She answered all of my questions, but there was probably 30 steps that went into all of that before you walked through the door. So.
That's the one that popped into my head is I don't think people realize, even though I'm only in the office 2 days a week, all the real work gets done on the days I'm not there.
Correct, yeah.
And people don't realize that when you guys are seeing patients with me, you're not getting a lot of, I'm doing quotation marks here, work done in terms of helping people prepare, but that you guys and we have some fabulous MAs in the office that help as well. How often you guys meet, and Lindsay does a lot of the initial consultation, but how much of this stuff we do as a team in terms of meeting together, people following up with other office. I don't think they realize how much work goes into preparing people for those things, so that when I walk in on Tuesday and Friday morning, there's 16 charts on my desk to sign up that are all laid out for scheduling, doing this, and working even with the surgery centers. As Travis knows, I mean, him and I probably talk at least 4 or 5 times a week in terms of schedule stuff behind, and a lot of that gets punted to Lindsay and to your team at your surgery center to make sure stuff's smooth.
Yeah, she's in constant communication with our scheduling office and our director to make sure that patients are getting in, we can schedule appropriately, and that's a lot behind the scenes that people don't see. They see the
when you're saying it out loud, I'm like, oh.
Why can't I schedule Wednesday at 7? Like, I don't understand. There's a lot of people involved. Does the surgery center have enough staff? Is there time? Is the OR open? Is it do we not just
do we have
nurses? Do we have labs? Do we have an anesthesia? Do we have all those things? So I think that's super important. Can we jump to a quote of a day? Does anyone have a quote? I feel like Gilberto has the little
he's got the sneaky eyes today.
I feel like I can contribute.
Well, why please? Why please?
I have one I think is appropriate given the topic. At least for
indulge us.
For me, anyway.
Indulge us.
So Ralph Waldo Emerson said, "Do not go where the path may lead. Go instead where there is no path and leave a trail." For me, that applies because this is all new territory for me with the telemedicine and virtual consults and virtual follow-ups and things like that. So this is like me going where there is no path.
So would you say that we are path?
Y'all are trailblazers, is what I'm
That's
saying.
what I'm talking about.
Yeah.
You got the machete out, man.
I was waiting
You're just
for.
cutting
There it goes.
I'm just like
cutting the trail.
I mean, growing up as a small child out in the rural community on the ranch, working from sun up to sundown, I feel like I'm well prepared.
Yeah. I don't know how much I believe that, but okay.
I got a picture of me
I
on a
could barely
tractor.
handle that
We'll find that for you. I think that's a great one, and I think that really sets the times now. I think you can either be someone who says, "Woe is me, the sky has fallen," or you can say, "Hey, I'm going to be a leader. I'm going to create a new path. I'm going to set forth and help lead the way through this." And I hope that we're trying to help. And like I said earlier, to anyone who's listening, if there's any physicians, other things, we've actually talked about this topic yesterday on Real Self University to help guide some of the other physicians on how to do this. So there's going to be some different platforms, but anyone can reach out to us. I'm sure that Lindsay and Sarah would be happy to talk to any other practice office team members if they would like some assistance, because we truly want to help everybody.
Absolutely.
Sure.
Make that.
I think one last good point to kind of bring up to summarize everything, though, also would be a big concern I've noticed is patients are asking, is the surgery center safe with the COVID-19? And I think that's a really great point because you're not in a hospital setting. And I think that you could maybe speak a few things on that just to reconfirm.
Yeah, so similar to you guys in the office, people, they they don't really recognize or understand that we're always taking the right personal protective equipment and gloves and sanitation of the room and wiping everything down post-operatively, and even the waiting room and everything. We're already doing that. That's not something that just started because of COVID-19. The other thing, we have taken steps to limit the number of people in the ORs. We've taken steps to limit the number of extra staff that offices can bring to the surgery center. We've limited how many family members patients can bring back to one in the pre-op area at this point. And these, again, are not to be mean. We're just trying to decrease the amount of people to decrease the potential for transmission.
But you're not a hospital either, so you are a surgery center. You have to be healthy, right, to have an elective procedure. So you don't have all of the fever patients and cough, cold, flu, whatever it is.
But that's exactly right. We don't have any inpatient medicine patients or anything like that. We're just a surgery center, not just a surgery center, but we are a surgery center. We're not attached to a hospital, so we don't have those other high risk patients.
And that's to Lindsay's good point there. And it's not just now, but we also don't have the patients who are having wound debridements and other bacteria and those type of things. I think to her other point about that is that it's also not the high flow of, when I was in Taiwan, there was 110 OR beds in the hospital.
Exactly.
Correct me, but you guys have three
we have
at the
three
surgery
operating
center.
rooms.
Very boutique, very, so there's a limited amount of ORs people at any one time. And this is just, again, safety and so forth.
Exactly.
I think a lot of people don't know that either, because they think of surgery center, okay, well.
Oh my gosh, I'm going to go to a big
hospital.
tertiary
Yeah,
hospital.
exactly.
That is not the case.
Yeah, I think that's a really good
we're just 3 ORs and a pre-op area and a PACU area, and that's the entire facility in a waiting room. So yeah, that.
I think that was an incredible point. So I appreciate it, guys. I appreciate all of you. I think this was an incredible topic. I think the timing was good, and we want to do our part to share that. So I appreciate everybody coming in for a little special edition here. Well, we got to take a team vote after this, so we'll see if you guys see Lindsay
no
and
more
Nurse
awkward
Sarah
silence,
back.
I promise.
So I'll be expecting an email about my virtual consult, or
Where are your pictures?
That's what I'm talking about. You got to lay down the law.
I need those pictures.
I want to thank everybody for coming in. I want to thank producer Donald for tapping his watch 12 times during this episode. Thanks for watching Plastic Surgery Untold, the #1 podcast as voted by me. Thank you. See you guys. Bye.